This developing story now. The Limpopo Health Department says it has recorded 2 deaths and more than 400 malaria cases since the beginning of the malaria season this year. The health department says the recorded malaria-related deaths were as a result of patients not seeking medical care on time. For more on this story, we joined via Zoom by Limpopo Health MEC Dr Phophi Ramathuba. Doctor, great to have you on the program. Welcome.
Morning, Blaine, and morning to all your viewers out there, and thank you for inviting us.
It's an important story to get to the bottom of, a resurgence of malaria cases. Why?
I think what I also need to clarify is the fact that since the beginning of malaria season, up until 2 weeks back, we only recorded 206 cases. And the next 2 weeks up to now, we noted a spike. But when we got deeper into investigating what could be the cause, would it necessarily be a resurgence or an outbreak? But we realized that 2 weeks back, Blaine, we launched as a province an active surveillance program on malaria cases, wherein we have trained our community healthcare workers to be doing door-to-door, and they will be able to test. They've got rapid test kits where they will test people for malaria. We are actually doing what we call case finding, and we have also trained our environmental health practitioner to can initiate oral treatment coatem for malaria, and the DG has approved that. So that work which we have done has been able to assist us in picking up malaria cases very early, and it sounds like you are having a spike, whereas these are people who ordinarily would not even know that they've got malaria. Their body and the immune system will fight it on its own, but in the process they were going to spread malaria cases. Why I'm saying this is because in our hospitals currently we've got low cases of admissions of malaria, and if you look at mortality rate, it's very low comparatively speaking to the previous years. So but we think this increase in number of cases could be as a result of our program of case finding.
Right. So let's understand this a bit better. Since the beginning of the malaria season, the province has so far recorded 406 malaria cases, which unfortunately 2 people have passed away. How would you define a malaria season?
For us, malaria season usually from July up until May the following year, but in the past it used to be up until April. But now, since 2017, we even extended to May. So that is for us a malaria season. Right. And usually the cases will peak around September and October. That's what we would usually see in the time when you have got serious malaria outbreak in the province. You will see around December and January. That's where you will have high volumes of people testing positive and being actually sick of malaria in the province.
Which districts, MEC, are most affected?
I think the Wembe district, it is known to be a malaria endemic, and also Mopani district, because those 2 districts, one has recorded 194 cases, another 183 cases. But we have seen a trend this time around, wherein even Sekhukhune has recorded 8 cases, and Waterberg 10 cases, and Capricorn 10 cases. These 3 regions, a district, have never been malaria endemic district, but we are saying because of the movement of people. You know, Sekhukhune, it's a mining area, and Waterberg, and people will travel from Mozambique to come to work, and people traveling from Palabura to go to work in those particular 2 regions. So what we refer to as taxi mosquito or paperback mosquitoes could be responsible for these 10 cases that's happening. But also one of the issues which is making us to have these cases being picked up early, which I must condemn the team in the province. It's because even when you, our guidelines, we have amended them, Blaine, to say when a person presents with COVID-19 symptoms, everybody in the province must be tested for malaria too, because they almost present the same. Disease like meningitis, you must make sure you rule out a malaria on that. And secondly, if somebody tests positive for malaria, we must also go and do contact tracing like we were doing with COVID. Go and visit the household, visit the village, start to do house-to-house testing and pick those cases up when it's too early and where they only need 3 days of oral coartem. That's why we say malaria, it's very easy to treat, very easy to prevent, but unfortunately, if you don't do the two, malaria will kill you.
Well, this is an important point that you raise, MEC, with regards to understanding how, first, number one, how malaria spreads and the symptoms. When you think malaria, you think mosquitoes. Talk to us about, if it goes further than that, how else can you contract malaria and those symptoms. Please run through those symptoms for us.
But mainly malaria, it's being transmitted by the female mosquito, which we refer to as Anopheles mosquito. It's not every mosquito. People always laugh when I say it's a female one. So they will say, oh, females, women, you are so dangerous. Even with mosquitoes, the female ones are killing us. So when you visit a malaria endemic, like for instance, you are residing in Gauteng, it's not a malaria endemic area, but festive season is coming. You might wish to go to Kruger National Park. You need, before you go on holiday, study the area you are going to visit. Is it a malaria endemic area? If that is the case, visit your doctor. Let your doctor prescribe to you malaria prophylaxis. But also carry all those mosquito repellents that you can use in your hotel room. I want to believe that there will be an aircon. Sometimes there are fans which are able to assist you. But also as a department, we work with the tourism sector, wherein we do support all the lodges by sending our teams at the beginning of each malaria season. We go and do indoor residual spraying and assist and support each other. So most of our lodges become safe because we also train the staff there to understand how to prevent malaria. So the first way is for this indoor residual spraying, which government will do for you. But the second, it's you yourself. Make sure even your children don't play or yourself sitting at night in the dark because we would have sprayed inside the house. But outside the house, mosquito can still bite you. But also try to wear, when you're sleeping at night, wear long sleeve clothes. Right. But we are also teaching the people to say, because it's raining season, when it rains, make sure that you discard water. Don't allow water in your buckets and all those. Lastly, in terms of the symptoms, when you have got a headache, when you've got fever, some people even vomit, others even have diarrhea, others have got joint pains, and all those symptoms that you have, flu-like symptoms, COVID-19 symptoms, meningitis, and many upper respiratory tract infection. Try to make sure when you go back home after festive season, when you go to Gauteng, explain to your doctor, not only to test you for COVID, test me even for malaria. Because the critical point here that I want to make is that patients that we usually lose, it's patients who would not necessarily visit a malaria endemic area doctor or nurse. Doctors in Bembe and Mopani, they know every case, rule out malaria. But in Gauteng, because you are not used to malaria, people tend to miss the case. And unfortunately, you will do all the lumbar puncture trying to rule out all the other conditions, forget that it could simply be malaria, which can simply be treated 3 days of oral coartem.
And it's when you mention all the symptoms with regards to malaria and COVID-19, you can easily misinterpret them, isn't it? So no matter what you're feeling, don't assume that it's one or the other. Seek medical advice if you're unsure. Malaria, I guess, remains a fatal disease if it remains undiagnosed and untreated. It's preventable, it's curable, but it kills as well. So I guess communities need to be vigilant, and so does government. But thank you very much indeed for coming on, give us some insight into what you're dealing with, the state of play with regards to malaria. Be well, MEC.
Thank you very much.